Thanks for watching ERi-TV, dear viewers. Here are the headlines. 5 patients diagnosed positive for COVID-19 in tests carried out today. Regular session of DLCOE Governing Council of Ministers convenes in Asmara. Global COVID-19 cases and death toll continues to rise. At least 20 dead as houses collapse in Pakistan earthquake. Announcement from the Ministry of Health. 5 patients have been diagnosed positive for COVID-19 in tests carried out today at quarantine centers and testing stations in Asmara Central Region. Out of these, 2 patients are from quarantine centers and 3 patients are from testing centers in Asmara Central Region. On the other hand, 3 patients who have been receiving medical treatment in hospitals in the Central Region have recovered fully and have been discharged from these facilities. The total number of recovered patients has accordingly risen to 6,666, while the number of deaths stands at 42. The total number of confirmed cases in the country to date has increased to 6,734. Ministry of Health, Asmara, 7 October 2021. The 66th regular session of the Desert Locust Control Organization for East Africa, DLCOE Governing Council of Ministers, commenced today, 7 October, at Asmara Palace Hotel. Ministers of Agriculture of Eritrea, South Sudan, Somalia, Djibouti, Uganda, Ethiopia, Sudan, Tanzania, and Kenya are participating. The regular Governing Council of Ministers session is the continuation of the 66th regular session of the DLCOE Executive Committee that was held from 4 to 6 October. In his keynote address, the Minister of Agriculture of Eritrea, Mr. Arafai, highlighted Eritrea's experience regarding control of desert locust and stated that since 2006, the world is passing through a period of food shortages and soaring food prices, mainly due to crop loss caused by pests and diseases, and underlined the role of the Desert Locust Control Organization for Eastern Africa in tackling the situation. The Executive Director of the Desert Locust Control Organization for Eastern Africa, DLCOEA, Dr. Stephen W. Njoka, on his part, noted that member countries are using chemicals to control pests that are harmful to human safety and environment, and underscored the urgency of switching to biological and mechanical means of control. He further indicated that the organization is working on developing components of preventive, eco-friendly, and more cost-effective mechanism for locusts based on benign and biorational control tools and tactics. The State Minister of the Ministry of Agriculture, Animal Industry and Fisheries of Uganda and Chairman of the DLCOEA Governing Council of Ministers, Mr. Fred Bouino Kiakolaga, on his part, noted that the organization has continued to promote food security in the region through its mandate of combating the migratory pests, namely desert locusts, quelea birds, armyworms, and tsetse flies. He also commended the organization for saving member countries millions of dollars by protecting their crops and not importing food. The 66th regular session of the Desert Locust Control Organization for Eastern Africa, DLCOEA, Governing Council of Ministers, will continue tomorrow. The Health Office at Golij Subzone reported that the effort to provide efficient health service to the public is registering encouraging result. Mr. Gilay Musazgi, head of the office, noted that as part of the effort to put in place infrastructure of health facilities and health practitioners there are 2 health centers, 7 health stations, as well as 18 drug shops in the subzone providing commendable health service, indicating that the number of quality of health professionals is increasing from time to time. Mr. Gilay said that the 2 medical doctors that were assigned recently are significantly contributing in the effort. Mr. Gilai also said that out of the 16 administrative areas of the subzone, 10 have introduced community-based environmental sanitation program, and that is contributing in the reduction of the prevalence of communicable diseases. Mr. Gilai further called on stakeholders to reinforce participation and contribution in the efforts to provide efficient health service to the public. That was our domestic news. Please stay tuned for the international right after the short break. The cumulative total of global COVID-19 cases has exceeded 237.2 million, with the death toll hitting 4.8 million as of today, according to World Meters. A total of more than 6 billion vaccine doses had been administered across the world. The United States case count exceeded 44.9 million, with the death toll surpassing 727,000, according to the data released by Johns Hopkins University. The U.S. continues to lead the world in the numbers of both confirmed COVID-19 cases and related deaths. India's COVID-19 tally rose to more than 33.8 million, as 18,300 new cases were registered across the country, according to the Federal Health Ministry's latest data. Currently, there are more than 252,000 active cases in the country, which is the lowest in the past 7 months. Likewise, another 33,869 people in Britain have tested positive for COVID-19 in the past 24 hours, bringing the total number of coronavirus cases in the country to more than 8 million, according to the official figures released today. At least 20 people have been killed and more than 200 wounded after an earthquake strikes Pakistan's southwestern province of Balochistan, local officials say, with rescue teams attempting to clear debris and gain access to the area. The 5.9 magnitude earthquake struck as most residents at the Harnai district, about 100 kilometers east of the provincial capital Quetta, were asleep at just past 3 a.m. local time, according to the United States Geological Survey data. The Provincial Disaster Management Authority said at least 200 people were injured. A survey of the damage to the houses and other buildings in Harnai is ongoing. Pakistani Prime Minister Imran Khan has ordered immediate assistance on an emergency basis to residents of the area following the earthquake. U.S.-Japanese scientist Syukuro Manabe, Klaus Hasselmann of Germany, and Giorgio Parisi of Italy have won the Nobel Prize in Physics for climate models and the understanding of physical systems. The jury's announcement came a month before the COP26 climate summit in Glasgow, where global warming will top the agenda. Manabe, 90, and Hasselmann, 89, share one half of the $1.1 million prize for their research on climate models, while Parisi, 73, won the other half for his work on the interplay of disorder and fluctuations in physical systems. Syukuro Manabe and Klaus Hasselmann laid the foundation of our knowledge of the Earth's climate and how humanity influences it, the Nobel Committee for Physics stated in its statement. Giorgio Parisi is rewarded for his revolutionary contributions to the theory of disordered materials and random processes. Thors Hansen, chair of the Nobel Committee, said the discoveries being recognized this year demonstrate that our knowledge about the climate rests on a solid scientific foundation based on a rigorous analysis of observations. A quick recap of today's news headlines. Five patients diagnosed positive for COVID-19 in tests carried out today. Regular session of DLCOE Governing Council of Ministers convenes at Asmara Palace Hotel. Global COVID-19 cases and death toll continues to rise. At least 20 dead as houses collapse in Pakistan earthquake. And that was our news for tonight, dear viewers. It is good night from us.